The day of the surgery, you're going to meet many people at the hospital. They'll get you ready for your surgery. They'll talk to you about your medicines, and so you want to make sure you have a current list of your medicines.
Hi, I'm Tia, the Urology Nurse Navigator here at Memorial Medical Center.
We just want to spend a second to tell you about exactly what's going to happen during your surgery. In this first picture, you'll see the bladder, the prostate, and the urethra. The prostate is what's going to be removed during your surgery. In the second photo, it shows the robot actually removing the prostate. That basically just disconnects from the bottom of the bladder and from the urethra in the penis, and then gets removed. The bladder opening is then sutured to the urethra, and the catheter goes through that, and there's a balloon filled with fluid inside your bladder. That area is called an anastomosis, and that's the most important part that you need to know so that you are careful and cautious with your catheter and with any bending, lifting, twisting. That is what's healing over the next 4 to 6 weeks.
Hi, I'm Rich. I'm one of the nurses at 1E Main Surgery, the pre-op services. I'd just like to give you a little heads up of what's going to happen once you come to visit us. So when you first come into 1E, we'll get you set up, we'll take your height and weight, get your blood pressure, all your vitals. Then after that, I'll come in and ask you some questions about your medications. We'll go over your health history, any kind of prior surgeries that you've had. And then after that, I'll get ready to place an IV in you, and this is how we'll give you fluids and medications to get you ready for surgery. And then also we'll have an anesthesiologist come ask you questions about how you do with anesthesia, if you get nauseous or any vomiting, that kind of stuff. After that, and then right before you go down for your surgery, we'll have a nurse anesthetist and a circulator nurse will come and give you some medicine, kind of help you relax before you go down to surgery. Because I know coming to surgery on an unfamiliar environment can get pretty nerve-wracking, so we'll have some medication for you to help you relax. After your procedure, we'll go to pack you for recovery for however long you need. We'll give you some more either pain medication or nausea medicine if you need it. Then after that, you'll come back to us and then I'll give you more details about that. Okay, so now your surgery's over, you've been to recovery, now it's time for you to go home. So you'll come back to me or another nurse, it may be someone different, but this is what we call our phase 2 or our discharge to home. So once you come back to us, we'll take your vitals, make sure you're doing okay, and then also we'll give you something to eat and drink. And we'll start off light. We'll give you fluids at first, make sure you can keep that down after your procedure and with the anesthesia. Then after that, we'll give you some crackers, cookies, Jello, just easy food for you to digest. After that, I'll get started on your discharge paperwork, and I'll go over the ins and outs of what you will go to when you go home. So you definitely will be going home with a Foley. We'll give you the right supplies for you to go home with that, and we'll give you every detail about how to do Foley care, and we'll make sure that you're comfortable going home. And also while you're back there, if you're still having some pain and nausea, we'll definitely give you some medicine to make you more comfortable. Also before you go home, we'll have an anesthesiologist see you one last time, just make sure that your nausea and your pain is under control. One big thing we want you to do, we want to have you start walking when you get back to us. So when you'll come back to us, you'll probably be in a wheelchair, but we'll put you in a recliner because we want you sitting up. And then once that anesthesia wears off a little bit, it's very important to have you ambulate early. We don't want to have any complications from the Foley. It's very good for your bowels to be moving too, because everything's going to be slowed down with the procedure and with the anesthesia. So it's very important to move. We don't want to have any complications with your Foley if it's not leaking properly, but early ambulation has shown to really improve that.
When you wake up in the recovery room, you'll have a catheter in your bladder. Some people can have some pelvic pressure, and it can be fairly intense. It doesn't happen a lot, but that's called a bladder spasm, and that's your body's reaction to having a foreign body in your bladder, and it tries to squeeze on it, and it causes a crampy sensation in your pelvis. If you have that, first thing, make sure your catheter is draining. If the catheter is flowing well and you have that sensation, we have medicine that you can put underneath your tongue to help alleviate that. But not everybody needs this. So if you get sent home and you have that sensation, give us a call.
Hi, my name is Ashley. I'm a patient care facilitator on 5B at Memorial Medical Center. We'll talk more about my role in just a minute. The first people that you will see upon arrival to 5B include your patient care tech and a nurse. The tech will attach you to your vitals machine, and your nurse will monitor your blood pressure along with other vital signs. Other people that you will meet while on 5B include the discharge planner, the social worker, the pharmacist, the urology nurse navigator, and myself, the patient care facilitator. Things that we helped to assist you with include education with your catheter, Kegel exercises, coughing and deep breathing, and along with your nurse, we ensure that you're drinking plenty of fluids and your pain is under control. Lastly, the best part is your discharge. We ask that you get out of bed around the first 4 to 6 hours after surgery that first day, if possible. Otherwise, we ask that you do that as soon as you can. Lastly, we ask that you have family or friends to come pick you up the next day around lunchtime in order to be able to take you home.
Prior to your discharge, you'll receive a blue folder just like this one. On the inside, it has valuable information that I encourage you and whoever may be staying with you or caring for you during your recovery to review. It's got valuable information about your recovery and resources for you. Please, if you can, make sure you review this, and if you have any questions prior to discharge, ask your nurse or myself. I'd like to take a moment to prepare you for surgery and recovery. There are some items you may want to pick up at your local store. After prostatectomy, you will have a Foley catheter in. When the Foley catheter comes out in about a week to 10 days, you'll need to have male incontinence pads. You can pick those up at Walmart, Target, Walgreens, CVS, pretty much any store around town. Make sure that you take a couple of those pads to your follow-up appointment. While you're at the store, there are some other items that you can pick up to help with your recovery. Dr. Lieber talked about some urethral discomfort where the catheter comes out of the penis. You can apply Neosporin or triple antibiotic ointment to that area 3 times a day to help with that discomfort. Another medication that you may need to get, and we encourage you to get, is called Colace. It's a stool softener. It's not a laxative and doesn't help you to go. You may need to pick that up as well. The Colace is twice a day and is an over-the-counter medication. A laxative is a medication that stimulates the bowels to function. Sometimes after surgery, anesthesia slows these things down, and you may need medication to help stimulate that. Milk of magnesia or Miralax are good options, and you can just use them as directed on the bottle. After this type of surgery, men find that they have some discomfort in the perineal area. That's the area between the scrotum and the anus. By having a neck pillow you can use to place on a chair or in a car, it helps alleviate that pressure and does give you some relief. Lastly, while you're at the store, I encourage you to pick up some bland food. After surgery, your bowel function is not what it used to be prior to surgery, and so we encourage you to eat frequent, light, bland foods until you have a normal bowel movement. Bland foods include applesauce, peanut butter, lean meats, soups, eggs, rice, potatoes, crackers, or toast. All of these things you could pick up prior to your surgery and have at home waiting for you for your recovery.
After surgery, there's a couple things that we encourage you to avoid. We want you to avoid heavy lifting. It's very important that you don't wear out your pelvic floor muscles. So although we want you to walk, we don't want you to be a marathon walker. So try to keep your exercise maybe a half a mile or less a day in walking. In addition, after surgery, there's a lot of pain medicine that the anesthesiologist gave you, so constipation is very common. You'll want to be on a stool softener like Colace, 100 milligrams, or maybe milk of magnesia, or maybe you can manage your bowels with simply coffee or prune juice. Generally, people might ask, where's my pain medicine? Well, your pain medicine's at home. If your kidney function's good and your liver function's good, we simply want you to go home and use Tylenol and ibuprofen for pain. We've been doing this for years and people do really actually very well. Avoiding the opioid pain medicine also prevents some of the constipation that many people would have, upset stomach, or even nausea. Throughout your week post-operatively, you'll have your catheter and you're going to come back in 1 week after surgery. We'll get your catheter out. It won't be near as bad as you think it is to get the catheter out. We'll simply deflate the balloon and gently pull the catheter out. It slides out easily. Each of your incisions, or your port sites as we would call them, has a Band-Aid or a sticky adhesive over them. That's okay. Leave that on for that week unless they start to fall off on their own. You might even see a piece of white tape called a steri-strip. Leave that on, they get very sticky, and they may stay on for a week or 2 weeks. They'll be just fine. If you want to put some bacitracin or Neosporin ointment on it, that wouldn't hurt a thing. Each of those incisions, especially the one around your belly button, are closed with an absorbable suture. Some people come in a couple weeks later and they see a little white string at the very edge of the suture line. That's simply your body spitting out a little bit of that absorbable suture, and that's okay as well. A couple weeks down the road, you'll be able to simply pick it off like a piece of fuzz. When you come back to see us 1 week after surgery, we usually will go over your pathology report at the same time we get your catheter out. Occasionally, the pathologist needs a little bit longer to go over the pathology report, so we'll give you a call down the road. You'll either see myself or one of my nurse practitioners who are trained to see what to look out for after surgery. Additionally, people want to know when can they resume their lifting and their normal activities. Well, a week after surgery, since you're not using narcotics, you should be able to drive. You should be able to walk around and go to the store or to the coffee shop. But we don't want you to do any heavy lifting. As you progress through the healing process after surgery, we talk about the rule of fives. Every week, 5% more activity and 5 more pounds. By week 5, if you're doing good, you can go ahead and listen to your body and resume most of your normal activities. But if you find that you're still having problems with leakage, be careful with the heavy lifting, be careful with ladders, and a lot of bending and stooping. During the surgery, some patients are candidates for nerve sparing. Everybody comes to surgery as a different subset of problems. So for instance, if we're trying to preserve sexual function and you were having difficulty having erections before surgery, you're probably going to have difficulty having erections after surgery. So you may go home with a prescription for something such as a daily Cialis.
If you are a nerve-sparing candidate, he will write a prescription for you for either sildenafil or Cialis. GoodRx is a wonderful resource for you, available online. If I'm here, I can print out the coupon for you, but the coupons are very easy to find. You type in your medication and how many tablets you want, and it will print out a coupon for you to take to the pharmacy. Many pharmacies are listed, and so your home pharmacy may not be the least expensive of the group. So you can look through and print the coupon that is cheapest. The same medication is available at all pharmacies, but the cost to you may be different. So I highly encourage you to visit GoodRx, G-O-O-D-R-X, and print the coupon if you're a nerve-sparing candidate and he has required you to take Cialis or sildenafil.
After surgery, you might find that the more active you're getting, you're starting to feel better. You might see a little bit of urine come around the catheter or maybe some blood in the catheter. So someone might say they went out, did some shopping, did quite a bit of walking, or had a large bowel movement. They might notice a little bit of blood in their catheter. It's okay. As long as the urine is flowing through the catheter and it's not backed up. Remember, if you're not having urine drain for about an hour, we want you to give us a call. But if you're out and about and you have blood in your urinary leg bag or in the catheter bag, it's okay. Probably push more fluids. Drink plenty of fluids and it should be okay. It's probably related to just activity. But remember, our first and foremost goal in this whole procedure is to get your cancer cured. We want your urinary control back. But rest assured that most people get their urinary control back generally within 3 to 6 months. And we want you to find the sexual intimacy that you desire. So be patient, obey your instructions, and do your Kegel exercises.
So some of Dr. Lieber's patients will qualify for the ERAS, or it's called Enhanced Recovery Program. This entails the full liquid diet the day before, but also adds drinking 2 12-ounce bottles of clear or yellow Gatorade on the night or day before surgery, and 1 12-ounce clear or yellow Gatorade at least 2 hours prior to your surgery on the day of your surgery. If you are diabetic, please make sure that you pick up Gatorade 2 or G2 that's lower in sugar. You will get several medications on admit to help with your recovery. And the expectation is that you will be going home the same day of surgery, or at least within 24 hours of your admission. I also want to share that there's a prostate cancer support group at Memorial Medical Center. It's called Us Too and meets every second Wednesday of the month except for November and December. Please call me, Tia, if you are interested at 217-757-2094. I highly encourage this group, as many attendees have been through surgery, radiation, or chemo and can share their insight with you. It is very comforting talking to someone that has been in your shoes before. Please give me a call.
I'm Christina, Dr. Lieber's nurse. So once you've decided you want to have the prostatectomy done, I will either see you in the office or I will call you on the phone to schedule your procedure. Some of the things that I will go over is the location. We always do it at Memorial Medical Center. Some of the days are typically Mondays, Thursdays, and Fridays. We usually try to schedule at least 3 to 4 weeks, if not longer, out to allow you to do the Kegel exercises to get the adequate strengthening ahead of time. After we decide to pick on the date, we'll get that scheduled at the hospital, and then I will go over the diet information for the day before. You're usually on a liquid diet the whole day before. And then we will have you wash with a soap called HIPAA the night before in the morning of surgery. Also, I will schedule your pre-op appointment with your primary care physician to make sure you have clearance before the procedure. And you may also need to see your cardiologist ahead of time if you have a heart history. I will also check with the insurance, or we also have a pre-cert nurse that can do that as well and just make sure they will cover the procedure. So a lot of times patients will ask about the insurance and the approvals. That is something that our office will take care of. We will contact them, make sure they approve it, and we usually just do it for a 23-hour observation. So you should go home either the same day or within the 23 hours. Another question the patients ask is also about the lifting restrictions. There is no lifting over 10 pounds for at least 4 weeks. So another letter you'll receive is what's called the prostatectomy letter. It's just kind of what to expect after surgery. So if I see you in the office, you'll get it then, or otherwise I will mail out that information to you. That just will summarize some of the stuff Dr. Lieber talked about the erections and the incontinence, and kind of just what to expect after surgery. So one thing that's not uncommon to happen is having the blood in your urine. It may clear up right after surgery, and then when you get home for a few days, you don't have any blood, then all of a sudden you're having a large amount of blood. Usually that's because you have become more active towards the end before we get the catheter out, so that is not uncommon. If you notice that when you push fluids, you take it easy. If it does not clear up, give our office a call, or if you notice the catheter is not draining, you need to give our office a call as well. So during normal business hours, if you have questions, just call the Springfield Clinic number, the 528-7541. You just ask for Dr. Lieber's office. Usually it'll be I'm the one who answers the phone calls. I do have a couple of the nurses that do help me out on occasion. So we're your resource from the office, but if it's after hours or on the weekends, we have a service called Telenurse. You still call the main clinic number, and then they will direct you to a nurse. They'll see your issues, take down that information, then contact the doctor if needed for further recommendations. So typically for the procedure afterwards, time off work is a big question most patients have. You typically want to take at least a week off of work, if not 2 weeks, up to 4 weeks, depending on how the procedure goes. You will not be able to lift over 10 pounds for 4 weeks. So if you need to fill out some FMLA paperwork for your department or your work, you'll need to just bring that into the office. Our doctors do charge a $50 fee if it's over 2 pages, so you would just need to be prepared to pay that either when you pick up the letters or when you drop it off. So after you have your paperwork completed, I will give you a call to see if you want to come pick it up at the office or if you want me to mail it out to you. I cannot send it directly to your employer.
In preparation for surgery, there's a lot of anxiety and anticipation. We hope that this video has been helpful for you and anyone caring for you in preparation for your surgery and recovery. We wish you the best and thank you for choosing Memorial.